Hi, welcome to our educational video on cataracts, cataract surgery, and the types of intraocular lenses available for your cataract surgery. I usually like to compare the eye to an old-fashioned camera. There's a lens in the front of the camera, and without that lens, the camera wouldn't work. We're all born with a lens inside of the eye that helps focus images onto the film in the back of the eye, which we call the retina. These images are then transmitted by a cable, which we call the optic nerve, to the back of the brain where the images get processed. A cataract is a clouding of that lens in the front of the eye. It's important to note that cataracts happen to almost everyone past the age of 40. It's part of aging, but they typically don't bother patients until later in life. Apart from age, other factors such as genetics, certain medications, and underlying health conditions can also contribute to cataract formation. One of the first symptoms of cataracts that affect vision is difficulty driving at night, but other symptoms can include gradual worsening in the quality of your vision over time or frequent changes in glasses over months to years. Cataract surgery is the only solution when cataracts are affecting your activities of daily life and can no longer be improved with glasses. During cataract surgery, I will remove the lens you were born with, which has clouded, and I will replace it with a clear, thin, artificial lens, which we call the IOL or intraocular lens. Before we dive into the various lens options, let's take a moment to understand the three primary visual zones. The first zone is close up, and that's where tasks like reading a book, using your cell phone or tablet, or browsing through restaurant menus occurs. The second zone is the intermediate area, which is about an arm's length away, where activities such as working on the computer, checking your car's dashboard, or picking items from grocery shelves will take place. And last, we have the distance zone, where activities such as driving, attending concerts or sporting events, or watching TV will occur. Now, let's talk about the IOL choices. The first type of the IOLs is the monofocal or single vision lens. These lenses let you see well without glasses primarily at one distance, so they address only one of the three visual zones we just discussed, which means you will need to wear glasses to see clearly in the other two zones. For example, you can have the lens set to correct your distance vision to be able to drive without relying on glasses, but you would still require glasses to see clearly in the intermediate and near zones. This category of lens is typically covered by insurance. The second type of IOL is the multifocal lens, also called the lifestyle lens. Depending on the type of multifocal lens we choose, you could see clearly in 2 or 3 of the zones we just described, which would reduce or in some cases eliminate the need for glasses. This means that you may be able to see clearly up close, at arm's length, and in the distance. However, it's important to be aware of some potential disadvantages when choosing a multifocal lens. Some patients may experience halos or glare around lights, particularly at night, and some experience reduced contrast sensitivity. All that said, studies have shown that most patients, up to 96%, implanted with a lifestyle lens, would still recommend this procedure to others. It's important to note that if you have other serious eye problems, such as severe glaucoma, severe macular degeneration, severe dry eye, among others, you may not be an ideal candidate for a multifocal lens. The third lens option is the toric lens, which is appropriate for patients who have enough regular astigmatism, usually about 1 diopter or more. Astigmatism occurs when the eye is shaped like a football instead of a basketball or a sphere. That leads to uneven light being focused on the retina, resulting in blurred vision. The advantage of the toric lens type is that when appropriate, it provides the sharpest, clearest vision in the desired targeted visual zones, as it corrects for the football shape of the eye. Femtosecond laser-assisted cataract surgery, or FLACS for short, allows for more precision when performing cataract surgery. Femtosecond laser can improve outcomes in patients who are candidates for toric and multifocal lenses. That is why, assuming that there are no contraindications to femtosecond laser, we recommend proceeding with this laser if you're a candidate for one of these special lenses. In some circumstances, we can still use femtosecond laser if you elect not to proceed or are not a candidate for a toric or multifocal lens. In those cases, femtosecond laser will still offer more precision than standard cataract surgery, and we can correct lower levels of astigmatism. Furthermore, For those patients who won't receive a toric or multifocal lens, we will offer a lens that offers mild improvement of vision in an additional visual zone. Here at Chittick Eye Care, we're also proud to offer the Ally Lensar femtosecond laser, one of the most advanced and newest femtosecond laser platforms. The Ally Lensar platform allows the surgeon to do femtosecond laser in a sterile fashion immediately before proceeding with the rest of the cataract surgery in the same room. This allows for a smooth and safe patient experience that eliminates changing rooms mid-procedure. It saves time and increases comfort. It also allows for the entire procedure to be done in a sterile fashion. Keep in mind that cataract surgery is one of the most commonly performed procedures worldwide. It is an outpatient procedure, which means you can return home the same day. We typically do one eye at a time, with the other eye to follow 2 to 6 weeks later, depending on the situation. Nowadays, the success rate in improving vision is close to 100%, although there's always a small risk of complications, as with any surgery. These risks are explained in the consent form you will sign and be given a copy of when scheduling your surgery. Please read the consent form carefully and ask questions if you don't understand something. As you consider cataract surgery, it's crucial to discuss with our team and your surgeon which intraocular lens best suits your unique vision needs and lifestyle. If questions arise after the consultation with our team and you need more time to make a decision, a telemedicine visit can be scheduled with me, the eye surgeon, to further discuss your options. We realize that there are numerous things to consider, and it's essential to carefully weigh the pros and cons of your options. Please feel free to visit the other video links provided for additional information regarding the cataract surgery process, combined cataract and glaucoma surgery if applicable, and eye drops application. If you have any questions or concerns regarding your cataract surgery, please let us know. Thank you for watching.